Katharina, können Sie bitte dann das Recording einschalten?
Ja, habe ich schon.
Okay, this is to say good morning, good afternoon, good evening, wherever you listen to us. We have the great pleasure to welcome Professor George Tavartkiladze today for his first session on the syllabus audiology. And I don't think I have to introduce Professor George Tavartkiladze because everybody basically knows him. He is an outstanding scientist in the field of audiology. He is actively contributing to many international organizations, amongst them also the World Health Organization. And before I say a few words about Georgi Abielovich, I would invite Yekaterina and Udo to explain to our participants how to activate the automatic subtitle translation. And Katarina will do this in Russian, and Udo will do this in English. So please, Katarina and Udo.
Добрый день всем участникам. Сейчас я покажу, как включить перевод и субтитры в Zoom. Вам нужно посмотреть на экран. В нижней панели вы увидите значок глобус и CC. Вам нужно туда нажать на глобал и выбрать подходящий вам язык, чтобы слушать перевод. И нажмите затем CC, чтобы включить сами субтитры.
Okay, yeah, now in English, you can turn your language on when you go to the menu, and there is the subtitle function, and then please switch to your language, to your spoken language, and the presenter will present the webinar in English, and then the translation will simultaneously translate the English spoken in your language, and you can do that by switch on the subtitles and then choose your language. That's all. It's very easy, and please try if you have problems or if you have an issue, please come back to the chat and I will help you.
Okay, perfect. Thank you very much. I just wanted to suggest, in case of any problems, please do not hesitate to type into the chat and we will try to help you, because it is very important that you get the translation in case you do not understand enough English. Katharina, bitte jetzt das Slide wegnehmen. Thank you very much for showing how to activate the translation. And we now will take off the slide and we will have the translation, we will have the presentation, the slides by George.
Monica, sorry, we again asks help because he has no translation.
Sorry, there is no such possibility to choose the translation. For example, in my.
Okay, if you go to your menu with these 3 points, and maybe Katarina, can you go? Okay, and then you can choose translation subtitle on, and then
okay,
it should
just
work.
one thing. For example, in my situation, it wasn't chosen the captioning. Maybe many people has the same problem. At first, they have choose captioning. Then the captioning is we can see on the screen, and then choose the language.
Пожалуйста, и по-русски скажите.
Коллеги, у кого не высвечивается возможность выбора языка, Вначале необходимо посетить вот вкладыш More, и там выбрать captioning. После этого появляется иконка captioning, которая показана на экране.
Okay, thank you very much, Vegan. We are very lucky to have you because you identified the problem, and you not only identified the problem, but you solved the problem. So hopefully everybody is now in a position to have the translation. And we will also have Vegan, thank you so much, to check the quality of the Russian translation, because I want to be honest, it's the first time that we try this. And as you say, we are on a steep learning curve. So hopefully it would work. And if not, we will improve it for the next time. This is to welcome everybody again. Maybe somebody joined us a little bit late. So I said good morning, good afternoon, good evening, wherever you are listening to us, because we have different time zones. And in some of the countries, and I see we have participants from Australia, it is already evening time. Again, I welcome Professor George Tavartkiladze, Georgi Abielovich. I'm very, very happy to have you here. And he will present his first module of a syllabus on the topic of audiology. It's the first session, and George, we plan to have it on a monthly basis. We will announce the dates in the very near future, so you can plan. And also, George kindly agreed, at the end of the year, we will give you a chance to pass an examination, and you will get a certificate signed by George. George, as I said, is world-renowned, outstanding scientist in the field of audiology, actively contributing to many international organizations, amongst them also the World Health Organization. But he is also a pioneer in the sense of he brought the multi-channel cochlear implant to Russia, and he also introduced neonatal hearing screening in Russia. George, welcome again, and the floor is yours.
Thank you very much, Monica. First of all, I'd like to thank Monica for inviting me to prepare and present the course in audiology, because I consider it very important from different point of views, from diagnostic point of view, from basic knowledge point of view, and of course, rehabilitation. First session on this course today will be on physiology and functional anatomy of auditory system. Could I kindly ask you my presentation? It works?
No.
No?
Yeah.
We have all the participants on the screen now. So I think, George, you need to share your screen. Yes, it is here. Thank you.
Yep.
Is it okay?
Yep, it works. Fantastic.
Good. So we'll touch today structure and function of the outer ear, anatomy and physiology of the middle ear. We'll speak about functional anatomy of the inner ear, including microstructure, cellular motor, electrophysiology. Of course, we mention function of the auditory nerve and structures of the auditory pathway. When looking at the outer and middle ear, I will try to focus on how these structures process and prepare information from transmission to the inner ear. On this slide, you can see auditory periphery consisting of outer ear, middle ear, and inner ear. Outer ear. It consists of auricle and external auditory canal. and is separated from the middle ear by tympanic membrane. The main functions of outer ear are protection and localization of the sound sources, but there are also two additional functions which are not described in the literature. It's amplification of high-frequency sounds and determination of the displacement of a sound source in the vertical plane. It's necessary to remember that the external auditory canal in children is shorter and wider than in adults. Like any cavity, structures of external ear have resonant frequencies. External ear canal has resonant frequency of 2500 Hz or 2.5 kHz, 2.5 K, and auricle resonant frequency of 5K. As a result, is the amplification of incoming sounds of each of these structures at a resonant frequency up to 12-15 dB. On this slide, you can see amplification provided by external canal, it's 2.5, and auricle 5 kHz, and total amplification is about 25 dB. By shifting the sound source relative to the subject, we either amplify or attenuate high frequencies. You can see amplification and cutting high frequencies. Complex of structures influencing the passage of sound to the tympanic membrane consists of effects of head and body and effects of auricle and external ear canal. And as a result is a concentration and conduction of sounds to the eardrum, amplification of sound pressure at the level of eardrum at certain frequencies, and it provides the directionality function of the auditory periphery. We are shifting to the middle ear. It consists of tympanic membrane, cells of mastoid, tympanic cavity, ossicles, auditory or Eustachian tube, and muscles and ligaments of the middle ear. Tympanic membrane has conical shape with elliptical contours. Its area is of 85 square millimeters, but only 55 square millimeters are exposed to sound waves. Pars tensa, it's here, transmits the movements caused by the sound to the handle of malleus, and pars flexida shifts under the influence of changes in static pressure in the middle ear, protecting it from the effects of small changes in ear volume and pressure. It may contribute to a decrease in the ear sensitivity to low frequencies by shunting the pressure in the external ear canal, which is facilitated by low resistance of the pars flexida without biasing the pars tensa. The vibrations of the eardrum are unevenly distributed over its area. The highest amplification of vibrations during tonal stimulation of 2K is below umbo, but during low frequency stimulation, the point of maximum displacement corresponds to the posterior superior region of tympanic membrane. Between the tympanic membrane and the inner ear are three bones: the malleus, the incus, and the stapes. The handle of the malleus is directly connected to the eardrum, while its head is in contact with the incus. The long process of the incus, and especially its lenticular process, is articulated with the head of the stapes, and the stapes footplate is located in the oval window and anchored there by the annular ligament. Free ligaments limit the movements of the ossicles at low frequencies below 1K. The ossicles rotate around the axis formed by the anterior malleus ligament and the posterior syncus ligament. At high frequencies, the movements of bones become more complex, and we can see that at middle and in middle intensity levels, the ossicular chain moves in such a way that the stapes footplate oscillates like a door. The anterior portion of footplate enters and exits the cochlea like a piston. At very low frequencies and at very high intensities, the movement's direction is changed, and the footplate of stapes makes a rotative movement. In the middle ear, there are two muscles, musculus tensor tympani, which is innervated by trigeminal nerve, and musculus stapedius, which is innervated by facial nerve. You can see musculus tensor tympani and the tendon of musculus stapedius. It's here as well. Function. The stapedial muscle, the main function is protective. It provides sounds attenuation from 10 to 30 dB for loud sounds, more pronounced at frequencies below 2K. It means that the magnitude of this attenuation is 0.6, 0.7 dB for each decibel increase in stimulus intensity above the acoustic reflex threshold, which is usually about 80 dBSL. And second function is function of limiting distortion. It's achieved by both the presence of elastic ligaments in the auditory ossicles and the direct contraction of muscles located in the neurobony canals. The function of tensor tympani is non-physiological because it contracts with high-intensity acoustic stimuli, which are approximately about 130 and even more dB, and non-specific stimulation, for example, electrical stimulation of the skin behind the ear or airflow into the eye. But tensor tympani also controls the tension of the walls of the auditory tube and plays an important role in the reflexive opening of the tube. The combination of muscles and ossicles provides independent control of different parts of the ossicular chain. The presence of a joint between the malleus and incus facilitates inward movements of the eardrum by about 100-500 micrometers during contractions of tensor tympani muscles without corresponding movements of the stapes. Conduction of acoustic stimulus to the inner ear. An acoustic stimulus reaching the eardrum can be transmitted through the middle ear to the inner ear in three ways. First is by bone conduction through the bones of the skull directly to the inner ear, bypassing the middle ear. Second, through the airspace of the middle ear, and third, through the ossicular chain. And the third pathway of sound conduction is the most effective. A prerequisite is equalization of pressure in the tympanic cavity with the atmospheric pressure. I mentioned earlier that sound energy is transmitted from the eardrum through a chain of auditory ossicles, the footplate of the stapes, to the inner ear. However, if we assume that sound is transmitted directly through the air to the fluids of the inner ear, we must remember that fluids of the inner ear have a higher resistance than air. So what is the significance of the ossicles? If you imagine two people trying to communicate, one in the water and the other on the shore, you should keep in mind that about 99.9% of the sound energy will be lost. This means that approximately 99.9% of the energy will be reflected and only 0.1% of the sound energy will reach the liquid medium. This loss corresponds to a reduction in sound energy, approximately 30 dB. Let's consider how this potential loss is compensated for. Amplification is provided first by differences in the effective areas of a tympanic membrane. I mentioned that active space is 55 square millimeters, and the stapes footplate, which is 3.5 square millimeters. It provides amplification of 70 times, which is equal to 24.6 dB. Second factor is the lever system of ossicles, and it's due to the difference in length of the malleus head and the neck and the long process of the incus. It provides amplification of 1.3 times. And third factor, which again is not described in the literature, is an additional increase in the energy supplied to the footplate of the stapes is used to the conical shape of the eardrum, which when it vibrates is accompanied by a doubling of the force applied to the malleus. All of the above indicates that the energy applied to the eardrum upon reaching the footplate of the stapes is amplified by 17, 1.3, and 2, which equals 44.2 times and corresponds to 33 dB. The effects of this listed mechanism are limited by mechanical characteristics of the middle ear, including the stiffness of the tympanic membrane, the air in the tympanic cavity, the joints and ligaments of the auditory ossicles, and the mass and damping that limit the movements of the middle ear components and cochlear fluids. You can see that amplification provided by middle ear is not equal at different frequencies. Amplification provided by the middle ear depends on the frequency of stimulation, and maximal values are obtained at frequency of 2.5 K and are equal to 30 dB and even higher. Dependence of the gain on the stimulation frequency is called middle ear transfer function. The sound transmission, as I mentioned, there are three pathways, but now we'll consider air conduction. In the absence of auditory ossicles, acoustic communication with the inner ear is due to the difference in sound pressure level between the oval and round windows. Sound pressure is generated by sound-induced movements of tympanic membrane, which compress and rarefy the air in the closed tympanic cavity. At frequencies below 4K, the air spaces of the middle ear are small compared to the wavelengths, and the sound pressure at the two windows is approximately the same. The difference between the pressure at the windows and in the external auditory canal is typically about 30-60 dB, indicating the greater efficiency of the sound conduction pathway through the ossicular chain. And we can see here pathways to two windows. The magnitude of pressure and pressure differences at the windows are determined by the volume of the middle ear. A larger volume of the tympanic cavity creates less pressure and less acoustic coupling. Bone conduction. Due to the enormous differences in the impedance between bone and air, bone conduction stimulation of the inner ear cannot be considered an important component of normal auditory perception. Only high-intensity air conduction sounds can trigger bone conduction. If a vibration source is applied directly to the skull, the inner ear is stimulated by the conduction of sounds through the cranial bones. Vibration of the skull activate the cochlea through three mechanisms involving components of inner, middle, and outer ear. The bone conduction component of the inner ear primarily includes a deformational or compressional mechanism. Considering that the scala vestibuli has a larger volume compared to the scala tympani, the deformation of the fluid-filled capsule leads to compensatory displacements of the basilar membrane up and down. The deformation mechanism is complemented and modified by the compression mechanism. During compression, intracochlear fluid exerts outward pressure toward the oval window and round window. This is more pronounced in the area of the round window due to the greater flexibility of its membrane compared to the mobility of its tape's footplate. The result is a displacement of the fluid column from the scala vestibuli to scala tympani and the round window, and accordingly a displacement of the basilar membrane, which is enhanced by the fact that the total surface area of the scala vestibuli and vestibule itself is larger than the surface of the scala tympani. Middle layer component of bone conduction. The auditory ossicles are essentially suspended in the middle layer and can move independently of the rest of the head. The contribution of the middle layer is referred to as ossicular delay or inertial bone conduction. Due to inertia, the movements of a suspended chain of auditory ossicles will lag behind head movements, and relative motions influences the rocking motion of its tape's footplate in the vestibular window, providing signal transmission to the cochlear fluids. In case of when the bone vibrator is placed on the forehead, it causes oscillatory movements of the head from front to back. At low frequencies, when the head moves in the same plane as the vibrator, there is no ossicular movement. An outer ear component. This component is due to acoustic conduction and is designated as osseo-tympanic bone conduction. The outer ear component of bone conduction can be assessed by clenching the teeth without closing the external auditory canals and closing the canals by pressing on the tragus. Speaking about middle ear pathology, there are still open questions about how normal and pathological structure of the eardrum influence its function and how the function of the eardrum changes at high frequencies. The main effect of perforations is differences in sound pressure on both sides of the eardrum. A normal eardrum moves because the sound pressure in the middle ear caused by these movements is less than the sound pressure in the external auditory canal. Low frequency sounds pass through the perforation, reducing the differences in sound pressure on either side of the eardrum and thereby reducing eardrum movements. Due to physical limitations, high frequency sounds cannot pass through the perforated eardrum as effectively. So low frequency hearing loss and near normal hearing at high frequencies observed in tympanic membrane perforations depend on the size of the perforation. The larger perforations are associated with hearing loss over a wider frequency range. Based on the data obtained, the following relationship can be identified. Hearing loss due to perforation of the eardrum is more pronounced at low frequencies. The larger the perforation, the greater the hearing loss across a wide frequency range. Hearing loss does not depend on the location of the perforation. Perforations located in the anterior parts of the eardrum lead to hearing loss similar to that caused by perforations located in the posterior parts of the eardrum. Sound pressure in the middle ear influences the development of hearing loss, and the degree of hearing loss depends on the volume of the middle ear space. Perforations of the same size cause more pronounced hearing loss with a smaller airspace volume in the tympanic membrane. Auditory or Eustachian tube. Its length is about 38 millimeter. It is directed downwards, forward toward the center of the head at an angle of 45 degrees. Cartilaginous part is 2/3, and in children it is located almost horizontally. The cartilaginous portion of the auditory tube forms a valve that, when closed, protects the middle ear from pressure fluctuations in the pharynx that occur during breathing and also reduce the passage of voice into the middle ear. The auditory tube opens with contraction of tensor veli palatini muscle, and the muscle contraction contracts during swallowing and yawing. This also involves contraction of levator veli palatini muscle and salpingopharyngeus muscle. The auditory tube also opens with a positive pressure in the middle ear. Negative pressure in the tympanic cavity causes further closure of the auditory tube. Functions of auditory tube. First of all, of course, equalization of ear pressure on both sides of the eardrum, which is essential for optimal vibration of the eardrum. And a drainage function, the movement of cilia of the ciliated epithelium of the mucous tube removes mucus foreign particles from the middle ear. One of the essential characteristics of acoustic signals is acoustic impedance. The physical properties of acoustic resistance or impedance are fully manifested in the functioning of the middle ear. The impedance or acoustic resistance of the middle ear consists of components caused by the fluids, bones, muscles, and ligaments of the middle ear. Components of impedance: resistance and reactance. Resistance of the inner ear fluids to movement of stapes fluid plates, and reactance consists of is responsible for mass and stiffness. Mass affects primarily transmission of high frequencies, and stiffness has an effect at frequencies below 1K. It should be remembered that the resistive component of impedance does not depend on the stimulation frequency, unlike the reactive component. And inner ear, the most complicated part of the human body. On this slide, you can see ossicular labyrinth consisting of cochlea, vestibule, and semicircular canals, and cross-section of the cochlea. You can see three scala: scala tympani, scala vestibuli, and scala media. And in scala media, on basilar membrane, is located organ of Corti, and you can see 3 rows of outer hair cells and 1 row of inner hair cells, tectorial membrane, and of course basilar membrane. Again, scala media is separated from the scala vestibuli by Reissner membrane, from scala tympani by the basilar membrane. A lateral wall of scala media is presented by stria vascularis. It's suggested that the spiral ligament may regulate the tension of the basilar membrane and simultaneously support the stria vascularis. You can see cut of stria vascularis. The structure is multi-layered epithelium lying on the spiral ligament, penetrated by a network of capillaries. Blood supply is provided by spiral nodular artery, and main function is the primary metabolic control of the cochlea and the secretion of endolymph and the maintenance of its ionic composition. The perilymph, which is in scala tympani and scala vestibuli, has high concentration of sodium ions, and in endolymph are high concentration of potassium ions. Maintaining differences in the ionic composition of endo and perilymph is ensured by the presence of epithelial layers in the membranous labyrinth, which have many dense hermetic connections. Basilar membrane has length about 25-35 millimeters and has different stiffness in basilar and apical regions. In apical region, it's wider and it's narrower in the basilar part, and also fibers are different in basilar and apical parts. It provides the gradients of stiffness, which arises from its width increases towards the apex, its thickness, which decreases toward the apex, and its anatomical construction. And it provides the wave propagation and passive tuning of the basilar membrane. You can see propagation of the traveling wave. Organ of Corti, a real microstructure and schematic representation. You can see 3 rows of outer hair cells, 1 row of inner hair cells, basilar membrane, and tectorial membrane. And 3 rows of outer hair cells. You can see stereocilia of outer and inner hair cells. Again, outer hair cell, outer phalangeal cells, and inner hair cells, 1 row of inner hair cells, and afferent fibers. You can see these red fibers. Outer and inner hair cells have a different shape. Outer hair cells have cylindrical form, and the inner hair cells flask-shaped form. Outer hair cells have a dense cuticular plate which holds 150 stereocilia arranged in rows, which assume the familiar W or V-shaped form. But what's very important, the longest outer hair cell stereocilia are in contact with tectorial membrane. Such contact has no inner hair cell. Again, we can see beautiful electronic microstructural pictures, outer hair cells, dater cells, and efferent endings. The average length of stereocilia also depends on cochlear position. At the apex, it's about 8 micrometers. At the base, about 2 micrometers. The number of stereocilia decreases from the base to the apex. Also, which is very important, between stereocilia is an extensive array of cross-linkages, a large number of horizontal cross-links join stereocilia of the same and different rows together laterally, some way below their tips. Function of hair cells. Outer hair cell mechanically amplify low-intensity sounds entering the cochlea. The amplification is realized through the movements of outer hair cells stereocilia or the electromotility of the outer hair cells themselves. Inner hair cell convert vibrations in liquids into electrical signals transmitted by the auditory nerve to the overlying structures of the auditory pathway. You can see links, schematic representation, real links, and clearly presented on this slide as well. Outer hair cell, the apical surface is exposed to endolymph, which is high in potassium ions. The lateral surface is exposed to the perilymph, which is rich with sodium ions. And the plasma membrane you can see it, is packed with 10 micrometer particles, actin filaments, pillars, subsurface systems, and the plasma membrane is rich in the protein pristine. Tectorial membrane is a cellular matrix composed of filaments, fibrils, and homogeneous ground substance. Acoustic energy is transmitted to the inner ear through vibratory movements of a stapes footplate, the encoding of which into nerve impulses is based on the mechanical response of the basilar membrane and the organ of Corti in such a way. Transformation of mechanical vibrations of the stapes and fluids of the inner ear into nerve impulses transmitted by the auditory nerve is the main function of the inner ear. It works in such a way. Basilar membrane, we touched it earlier. Vibration characteristics are determined by the elasticity and width of the membrane and by inner ear conduction, but do not depend on changes in the elasticity of the round window membrane or the length of the cochlear duct, as well as on changes in the position of the stapes or fluid displacement. We can see traveling wave, traveling from the base to the apex, and stimulation with different frequencies. True vibration frequency, it decreases towards the helicotrema due to its expansion and decrease in tension in this direction. Given the differences in stiffness along the cochlea, which we mentioned earlier, the maximum vibration amplitude when stimulated with different frequencies occurs at different points along the basilar membrane. The response of the basilar membrane is a traveling wave that propagates to the apex. Place theory. The wave propagation towards the apex reaches a maximum and then sharply decreases in the region of the basilar membrane corresponding to the stimulation frequency. These results, first obtained and described by Georg von Bekeshi, formed the basis of the place theory in frequency analysis of the cochlea, for which Georg von Bekeshi received Nobel Prize. Low frequencies stimulate not only the apical region of the cochlea, but also its basal regions. With high frequency stimulation, basilar membrane displacement are limited to the basal region of the cochlea. The basal part of the basilar membrane is activated at all acoustic stimulation frequencies. Thus, the traveling wave always originates from the base of the cochlea. So, the basal portions of the basilar membrane responds optimally to high-frequency stimulation. Also, it also responds to low-frequency stimulation. The apical basilar membrane responds only to low-frequency stimulation, and there is a time delay between the onset of stapes movements and the vibration of the apical basilar membrane. Speaking about biomechanical response, which is really transformation in the inner ear, we need some measuring instrument, and such instrument could be used construction of tuning curves on the curves. On this slide, you can see tuning curve of basilar membrane, which is determined by simultaneous masking at different frequencies, and the peak of tuning curve is determined when the masking frequency is equal to the stimulus frequency. In this case, it's 8K. So it's isointensity curve of basilar membrane. In the right part of the slide, you can see tuning curves of single auditory nerve fibers in norm and in the pathology. Hair cell stimulation. Bending of stereocilia occurs due to differences in vibrations of the tectorial membrane and basilar membrane, caused by differences in their structures and fixation. The tectorial membrane, which has a large mass, counteracts the movements of stereocilia and sets in motion the hair cell and the basilar membrane. Cutting movements of the membranes perceived through the stereocilia presumably cause stimulation of the nerve endings at the base of outer hair cells, and the hair cell depolarizes and the generator potential occurs. With stimulation, the response of the basilar membrane to stimulation with two tones of different frequencies corresponds to distortion product of acoustic emission due to non-linearities of the basilar membrane. And you can see scheme of distortion product of acoustic emission, stimulation and generation. We can conclude that mechanical energy is converted into electromechanical activity by bending the stereocilia. The apex of the hair cell, or the region at the base of the shortest stereocilia, is the most likely site of the energy conversion. Opening of potassium channels, which you can see here, causes the entry of potassium ions into the cell, and as a result, cell depolarization. Outer hair cell motility. This phenomenon was discovered in 1991 by William Brownell, Jonathan Ashmore, and Beshara Kochar. It's a reaction. It means that the reaction of outer hair cell to sound is an active response expressed in the lengthening and contraction or bending of outer hair cells. Inner hair cells do not have this property called motility. Changes in the length of outer hair cell can be caused by an external electric field directed along the cell axis. Changes in the sign of the field are accompanied by shortening and lengthening of the outer hair cell. When the electrical field is oriented perpendicularly to the outer hair cell axis, depolarization of the lateral plasma membrane occurs on the side and hyperpolarization on the other. As a result, flexion movements of the outer hair cell are recorded, so-called bendings. This phenomenon was described by the group of our Institute, National Research Center for Audiology and Hearing Rehabilitation, together with colleagues from National Institute on Deafness and Other Communication Disorders in 1996. You can see, just to be relaxed, dancing outer hair cell. And rock and roll.
1, 2, 3 o'clock, 4 o'clock, rock. 5, 6, 7 o'clock, 8 o'clock, rock. 9, 10, 11 o'clock, 12 o'clock, rock. We're going to rock. Round 2 o'clock tonight, put your lights on. Join me home. Have some fun and dance like we're rocking around the clock.
Motility is a unique property of the outer hair cells, as unlike muscles that contract only, motility enables both elongation and contraction. It is believed that the stria vascularis provides the energy that allows the outer hair cell to move at a high frequency without becoming fatigued. Outer hair cells function as chemomechanical motor cells, while inner hair cells function as chemoneural sensory cells. How can outer hair cell motility affect cochlear mechanics? The stereocilia of the inner hair cell are not in contact with the tectorial membrane, as I mentioned earlier. At low and moderate intensity levels, the displacement of basilar membrane during the passage of the traveling wave responsible for passive processes in the cochlea are insufficient to bring the stereocilia of inner hair cell into contact with the tectorial membrane. Given that stimulation of the inner hair cell is necessary for afferent conduction, there must be some other mechanism that sets the inner hair cell stereocilia in motion, and this mechanism is active processes in the outer hair cells, increasing the displacement of the basilar membrane due to motility of the outer hair cells. Vibrations of the basilar membrane are transmitted to the stereocilia of outer hair cell via mechanical links, including the tectorial membrane. It is believed that the different centers of rotation of the basilar and tectorial membranes form a lever system that generates shearing forces between the movements of the basilar membrane and the reticular lamina. However, the process of stimulation of the stereocilia of the inner hair cells is much more complex and not fully understood. It was found that at least at low frequencies, inner hair cells are associated with movements of the basilar membrane due to velocity, while the outer hair cells are associated directly with movements of the basilar membrane. The discovery of the protein prestin, which is located in the plasma membrane of outer hair cells, but not in inner hair cell, has shed light on the mechanism of cochlear function. Prestin is a motor protein that can rapidly change its shape in response to changes in tension along outer hair cell membrane. It contracts, provides contraction with a rate of about 20 kilohertz. In a simple model, the tectorial membrane is a structure elastically attached at one end and free at the other. It has mass and rigidity that vary longitudinally along the cochlear partition. The electromotive response is asymmetrical and nonlinear, which increases distortions that can propagate backward from outer hair cells to the cochlear fluids and back towards the external auditory canal. And they are well known now otoacoustic emissions. On this slide, you can see David Kemp, who discovered otoacoustic emissions in 1978 with his first equipment, and transient evoked otoacoustic emission on this recording. And on this slide, again, is David Kemp, and David, me, and Adrian Davis, the #1 in epidemiology of hearing. It's International Congress of Audiology in Buenos Aires. And in 2012, I am giving David the highest award of the International Society of Audiology, Award of Aram Glorik. Innervation. There are two roots of innervation, afferent innervation and efferent innervation. The afferent innervation of the organ Corti consists of dendritic terminals of neurons whose cell bodies form the spiral ganglion. Inner radial fibers, type 1 fibers, are myelinated axons, and type 2 fibers are outer spiral fibers, which are unmyelated axons. Inner radial fibers innervate exclusively the inner hair cells and constitute the overwhelming majority of afferents, about 90–95%. Each inner hair cell is innervated by 10–20 type 1 neurons. Outer spiral fibers innervate the outer hair cells, but make up only 5–15% of afferents. In the basal part of the cochlea, they innervate the outer row of outer hair cells, and the outer spiral fibers cross the tunnel of Corti and at approximately 10 outer hair cells. The peripheral portion of the neurals passes into organ of Corti and innervate sensory cells, while their central axon forms the auditory nerve and terminates in the cochlear nuclei. Efferent innervation. The crossed and uncrossed olivocochlear bundles originate from the ipsi and contralateral superior olivary complexes, and the efferents innervating the outer hair cells are about 60–80% and are originated primarily from the crossed olivocochlear bundle and cross the tunnel of Corti in its superior part. The density of innervation decreases from the base to the apex of the cochlea. There is also the third innervation system, autonomic innervation. Within the spiral ganglion and the body spiral lamina, there is a plexus of unmediated nerve fibers originating from the superior cervical ganglion. This adrenergic sympathetic nerve pathway is primarily associated with vasomotor control of the spiral ganglion area. What's necessary to stress, the sympathetic innervation is absent in the organ of Corti and in the stria vascularis. The scala tympani has a potential of 0 millivolts, which is similar to that determined using the electrode located at a distance from the cochlea at any other point of body. The scala vestibuli also has the same 0 charge. A high positive endolymphatic potential of plus 80 millivolt is detected in the scala media. Within these cochlear hair cells, a negative potential of minus 70 millivolts is detected in the outer hair cells and minus 40 millivolts in the inner hair cells. The source of the positive endolymphatic potential and high potassium concentrations in the endolymph is the stria vascularis. Vibrations of the basilar membrane open mechanosensitive channels in the stereocilia, and the influx of potassium ions from the endolymph stimulates the cells. Endolymphatic potential increases the sensitivity of the hair cells by increasing the draining force not only for potassium ions but also for kalium penetration. And as a result is a motility of the outer hair cells which is increasing. The deviation of stereocilia towards the basal body of the hair cell is accompanied by an increase in ionic current and decrease of membrane resistance due to the opening of ion channels, and intracellular membrane potential, which is minus 40 millivolts, is decreasing by the entry of potassium, positively charged potassium ions in the cell. When the stereocilia are deflected away from the basal body of the hair cell, a decrease in positive ions is accompanied, and as a result, we have a hyperpolarization. Here we can see to the cell body, it's a depolarization, excitation, and from the cell body is hyperpolarization and inhibition. There is a nonlinear relationship between stereocilia deflection and receptor potential. An increase in stereocilia deflection in any direction leads to potential reaching saturation. With stereocilia deflection, depolarization changes always are more pronounced than hyperpolarization. Here you can see spontaneous activity of receptor potential, increasing amplitude of receptor potential with the sound pressure level, and tuning curves of inner hair cells. The hair cell transmits information about the acoustic signal by releasing neurotransmitter, which leads to excitation of afferent nerve fibers. The release of neurotransmitter is triggered by the entry of calcium ions into the cell through voltage-gated calcium channels. Depolarization of the hair cell leads to the release of neurotransmitter, which is accompanied by generation of an active potential. And we can see active potential, which we can registered during our electrophysiological testings. Trunk of the auditory nerve consists of afferent fibers, two types of afferent fibers and efferent fibers. Demyelinated afferent and efferent fibers exit the cochlea through the habenula perforata and form a bundle within the modulus. High-frequency fibers are located on the outer surface. Fibers with low frequencies, characteristic frequency, form the core of the auditory nerve. This bending of the frequency of a sound wave to the location of maximum activity within an anatomical structure is defined as a tonotopic organization, and this property is the main anatomic property of the auditory system from the cochlea to the auditory cortex. You can see functional tuning curve of auditory nerve fibers, which are coding the intensity in quite a limiting dynamic range from 30 to 40 dB. And pathology of outer head cells, we see the threshold of the apical portion of the curve is increased and the tuning curve is expanded. Next level are cochlear nuclei. The ascending auditory pathway begin processing information by converting simple codes into more complex codes. And now we are speaking about dynamic reach quite wide, about 100 dB. The higher the level, the more complex the coding and the wider the range. And finally, central auditory system. When considering the central auditory system as a whole, the concept of sequential and parallel processing of incoming information should be considered. Sequential processing is associated with the hierarchical organization of the auditory system. Information is transmitted from the center to another, a progressive manner from the nuclei of the brainstem to the key structures of the auditory cortex. Parallel processing requires at least two channels for information to flow along the auditory pathway. At the level of the auditory nerve, type 1 and type 2 fibers, afferent fibers, can be considered two channels reflecting parallel processing. Furthermore, as more channels are connected, parallel processing becomes increasingly important. The ascending auditory pathway in the central auditory system originates in the auditory nuclei and terminates in the auditory cortex. And the conclusion, the fundamental principle of the auditory system, the principle of tonotopicity, begins to operate from the basilar membrane and continues to primary auditory cortex. Understanding the fine mechanisms of the auditory periphery as well as the basic principles of the auditory system's electrophysiology is the basis for effective diagnosis and rehabilitation of various forms of hearing loss and deafness. Thank you very much. I'll be happy to answer your questions.
Thank you very much, George.
I am in 1 hour.
I just wanted to say it leaves me breathless, so to say. You mentioned the 121 slides in 1 hour precisely. It's just amazing. Now, this was, of course, an enormous amount of information. And I must admit, I have trouble to follow this. And I'm sure other participants, they are in the same position. Let me make a few comments. First of all, again, thank you so much, George. It's obvious that you have an enormous level of knowledge, and thank you for sharing this with us. I got feedback from Dr. Vigen Bakshinyan that the translation, automatic translation, was sometimes okay, but sometimes a disaster. And I am not surprised because it's a very difficult language. There are many specific words which artificial intelligence has not learned yet. And of course, it was also very fast. Now, let me please, George, will you agree that we will make your presentation accessible to all participants and also to people who registered? Because we had some 40 people participate, but we had 135 who wanted to come in. So we will make your presentation accessible in Russian.
You have it.
Yes. No, I just wanted your permission so
Yes.
we can send it to the people who participated today and also to the ones who were planning to participate but didn't make it for one or the other reason. That's one thing. So thank you very much for that. And then I would kindly ask you, George, as soon as you can plan, at least until summer this year, you will let us know when will be your next presentations, which day of the week and which time. Then I watched the chat. There were very few questions. One was, how often should we do the fitting of the speech processor? And I responded, this depends very much on, is it a very young child? Is it a child who can say already the quality is not the same? Is it an adult? So please, the person who asked this question, either speak up now or be a little bit more clear what's the situation. The other question was, there is a lady who has a cochlear implant. She got it in the year 21, and the speech processor nucleus 6 doesn't work any longer. And I responded, there is a representative of the company Cochlea in Kyrgyzstan. Her name is Nadira Mamirova. She could contact her. She can also contact our Dr. Shirin Jumabayeva at the National Center of Maternity and Childhood Care. But I also sent the link, my email address, so the lady can contact me. So everybody who wants to have a look into the chat, you can see the email address. So in any case, please address us. But now I have another question, I think, and this is in English from Jane Simpson. Now, George, can you see the chat or should I read it?
I'll check. Can you read? It will be quicker.
Yeah, I can start. Can you explain again how the bone conduction works or does not work, depending upon whether it is placed on the mastoid bone or the forehead? I work with many children who are in special schools and have a lot of head movement, and I wonder if they don't want to wear their VC, bone conduction hearing aid. Hearing aid, because it is working on and off, question mark. And then we have another question, and this is, Здравствуйте, я тоже из Киргизстана, мне 70 лет, мне установили слуховой аппарат в 23-м году, и я случайно его сломала. Можете вы помочь? Here again, пожалуйста, пишите. Я послала мой email-адресу, пожалуйста, пишите. And then there is Lali from Spain. Congratulations, Professor. Awesome lecture. Yes, this is the right word. Awesome lecture. Looking forward to attend more. Or next, can you explain about pathophysiology for auditory neuropathy spectrum disorder is another question. So I think we have to go, and then we have another question, which is from Maria Markova. But I think we will go to the question from Jane Simpson. Do you remember the question on bone conduction?
Yeah, it's here. I see this question. Yeah, concerning the bone conduction. Very nice question. It's up to place where they are placed. It's a mastoid or forehead. When they are placing on forehead, the ossicular chain is not moving because it's in its centrum. It's very good to diagnose single-sided pathology, conductive pathology, because lateralization will be in this place. When it is placed to the mastoid, we can check the functionality of cochlea on this side and contralateral side as well. Problem with moving heads in children, it exists, yes. How to decide will it work or not, bone and cord hearing aid? A problem.
Okay.
In small children, yeah, in small children.
So maybe you want to continue this very specific discussion with Jane.
Possibly, yeah, maybe.
Can of course provide
Yeah.
you with the email address. Jane
With pleasure.
Yeah. She's
okay.
3 years in Austria, and she's back in Australia now, working in Brisbane and weekends in Sydney. Maybe you answer one more question, and this is from Unish. I have problems in pronouncing the name, but it says, can you explain about pathophysiology for auditory neuropathy spectrum?
It will be special lecture, but briefly I'll try to explain pathophysiology. The problem is that in this patient, they hear but don't understand speech. It's the first symptom, and the pathophysiology. When we are trying to test hearing in such a child, we see normal otoacoustic emissions and cochlear microphonic, but no potential, no action potential, no brainstem responses, problematic to register cortical responses as well. The anatomical loci is, first of all, it could be inner hair cells, because outer hair cells are working very well. We are registering otoacoustic emission and cochlear microphonic, and outer hair cells are responsible for generation of these two phenomena. Or it's a pathology of synaptic transmission. In this case, we are speaking about synaptopathy. Next, but more complicated for the rehabilitation cases, are where we have problem with auditory nerve fibers. It's a true auditory neuropathy, and it's pathology or nerve or upper structures. We have no potentials or some kind of potentials to electric stimulations, but in this case, it's very important to check before the decision what we shall do. First of all, of course, hearing aid fitting and decision about cochlear implantation. It's necessary to wait, because this pathology also could be functional, because the majority of children are going through intensive care units with high levels of bilirubin, with prematurity, and it's possible to recover in some time. So it's necessary to wait for 24 months, and after that decide about surgery. And second, which is very important, it's necessary to check functional activity, functional status of auditory nerve fibers. It's fantastic if we have pre-synaptic pathology, inner hair cells of synaptic transmission pathology, but problem with auditory nerve fibers. It could be also genetic cause. First of all, otoferlin, which is presynaptic, responsible for presynaptic pathology, or pewakin, which is responsible for postsynaptic pathology, and the results of rehabilitation will be different, of course. But we'll speak about it during the special lecture.
Thank you so much, George, because this was exactly the question I wanted to ask. What about the indication for or against cochlear implant? Because we very often get this question. Yeah. Is it a classical neuropathy or is it synaptic disorder? We have to be very careful in we have to do very good professional diagnostics and then only decisions. So I think that was an excellent answer. Thank you so much for that. We have one more question from Maria Markova, and she is asking the question in English: what are the prospects for studying the anatomy and physiology of the auditory system, and what should we study? George, that's a big question.
I don't understand the question, but I try to answer. My absolutely 100% opinion is that without knowledge in physiology and the functional structures, functional function of the periphery and central areas of auditory analyzer, it's impossible to clearly explain and analyze the results of diagnostics. They are huge today. It's electrophysiology, it's psychophysical testing. So the basic knowledge is necessary. This is why this lecture was too heavy, too complicated, and too long.
No, it was not too long, but it was heavy, yes, and we have to digest it, so to say. You have lots of compliments. Amongst them is, I'm very pleased to let you know, Maria Boboshko joined us as well from St. Petersburg. Very happy to have her. And then we have a very nice also question. It's not a question, but it's an assumption kind of, and it's from Franklin Alvarez. And he's this excellent lecture, Professor Tavartkiladze. It was really detailed. I'm also particularly interested in how sound is coded at more central levels. Example given from the cochlear nucleus to the auditory cortex. Today it was presented at the end, but it is planned to be covered further in future sessions. Yes.
It will be requested, yes.
Okay.
About coding, I mentioned very briefly that only periphery, speaking about auditory nerve, the coding is simpler. Dynamic range is quite narrow. For acoustic stimulation, it's about 30-40 dB only. But if we speak about cochlear implantation and electric stimulation, this dynamic range will be about 10-12 dB, which is much, much more narrower. Upper structures are receiving this simple code and transferring this code in more complicated, complex coding. As I mentioned, for cochlear nuclei, this dynamic range will be about 100, but not only dynamic range, even code will be more complex. So higher structures, we'll speak about central auditory system. I mentioned sequential and parallel pathways. It's even more complicated, of course. But if it will be requested, I'll prepare a lecture on central mechanism as well.
Thank you so much, George. And as you see, we have lots of, thank you so much. It was very inspiring and so on. Of course, it was excellent. It was brilliant. It was George. So thank you so much. And please, George, as soon as as soon as you can plan a little bit, at least.
We'll discuss with you days, maybe even tomorrow, the day after tomorrow. Yeah.
Yes. And we will send out the schedule very soon so that everybody can plan accordingly. I know it's difficult because we have people from different time zones. And of course, many people have a full-time job, so they have to take time out, etc. But we will make the recording available. We will make the presentation available in Russian. And we encourage everybody, please, in case you have questions, send them in, because we will then forward these questions to Professor Tavartkiladze, and he will be happy to answer next time. So thank you again, George. Have a wonderful day. Thank you, Vivian, for being in the background and telling us what's going on with the translation. Thank you, Katarina, for your technical support. And of course, thank you, Udo, also for your technical support. And thanks everybody who participated today. I was very happy to see many people from different countries, and I wish everybody a very nice day, a very nice afternoon, or a very nice evening, and good night. Spokojnej noci to the people who are there.
Ciao, ciao.
Bye-bye. Thank you. Ciao, ciao. Bye-bye.
Thank you, George.
Thank you, Sue.
You're welcome. Brilliant, amazing.
So we will use, so we will be in touch again, okay?
Yeah.
Yeah. And George will be in touch. I will leave the room now. So recording.
Bye-bye.
Bye-bye. Bye-bye.